धन्वन्तरे भगवते वासुदेवाय अमृतकलशहस्ताय सर्वरोगनिवारणाय श्री 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 महाविष्णवे नमः. Good evening everyone. A warm welcome to a national level webinar series Karma Sadhana 2020 by Panchakarma experts. I welcome today's event head Dr. Syed Attar Fatima Ma'am, Principal of PGMC Ballari. I also welcome advisor Dr. Ravishankar Sir, Department of HOD Department of Travaguna. I welcome Dr. Pervaje sir. Today's guest speaker Dr. Ravishankar Pervaje sir, a renowned surgeon, Shushruta Ayurveda Hospital, Putturu. And I also welcome the coordinator, organizing secretary Dr. Doddabasaya Kendadmat sir, HOD Department of Panchakarma. I also welcome the coordinators Dr. Rajesh Sugur sir, Dr. Trishela ma'am, and Dr. Shilpa Shri ma'am. I also welcome all my PG classmates as well as UG and UG students as well as the participants. It's my immense pleasure. Dr. Fatima ma'am. Ma'am has graduated from Mysore University in 1980 in Shalatantra in the year 2007. Also nominated as ex-BOS member RGUHS and ex-Academic Council member of RGUS. Ma'am has published 15 articles and successfully completed a month of ROTP program in Kshara Sutra to the physicians. Ma'am is untiredly working for the upliftment of the institution. Now I request our head of the institute, Dr. Syed Attar Fatima ma'am, to give a keynote address for the today's session.
Good evening to all of you. I'm really pleased to welcome all the participants of today's series. First of all, I need to introduce myself. I'm Dr. Syed Fatima, Principal Taranath Government Ayurveda Medical College. Today, Taranath Ayurveda College is celebrating Taranath 129th Taranath Jayanti. On this auspicious occasion, I wish all my students and teaching faculty and all the participants a very happy Taranath Jayanti. And today also is a World Environmental Day. We celebrated Environment Day in a very novel way in our institution. On this auspicious occasion, the Postgraduate Department of Panchakarma, under the guidance of our HOD, Dr. Doddabasaya Kendadmat, a series of talks have been arranged, probably for 15 days or more. I just want to have a glance of the topics that are going to be covered for 15 days. The first and foremost, I would like to say is Dr. Ravishankar Pervaje. He is going to talk on the topic stroke management. He is a pioneer in the field of Ayurveda, a very renowned surgeon who has worked in various capacities as a very good clinician, very good teacher, practitioner. And I think in the year 1991, he developed this Pratisarya Kshara Karma. And he tried this Kshara Karma in various conditions like piles, fistula, fissure, and rectal prolapse. Because of his guidance, probably most of the surgeons and most of his students throughout state and throughout country are successfully and confidently they are practicing Kshara Karma and also Agni Karma. He is even pioneer in the field of management of stroke, Pakshagata. He has his own specific different type of management. I think his Agni Lepa is very famous throughout state. He is managing Pakshagata very well. So we thought of inviting him to this webinar, and we requested him to speak on stroke actually. Probably we are anticipating a very informative, exciting session by Ravishankar Parvaji sir. And also we have with us various speakers like Dr. Chandramouleshwaran, who is from Chennai, who is going to speak on principles and practice of Snehana. And we are having a session on 7th June, that is recent updates in Panchakarma by Dr. Pradeep L. Gram Prohit, and also our own student and a follower of a staunch follower and supporter of Ishwar Reddy sir, Dr. Kiran Gowda is also going to join us on probably on 8th June, and Dr. B.A. Lohit, who is going to speak on understanding and applications of Vasti Karma on 9th June, and Dr. Prashant Ji, A.S. Prashant. Students are very interested and very excited to uh, listen to Dr. A.S. Prashant because he is a very good orator and a very good speaker and a great clinician. And also we have with us our good friend, well-wisher Dr. Santosh Edeelli, young dynamic person, who was heading the department of Panchakarma in JMC Bangalore, but currently he is working as deputy registrar of Rajiv Gandhi University. Dr. Santosh Edeelli, he is going share his knowledge, abundant knowledge on the topic utility of different Snehana Svedana therapy in clinical practice on 11th June. And Dr. Anand Katti, he's also a very good orator. The topic concept of Rasayana and its importance. So, I go through these topics and the speakers. What I just want to appreciate the head of the Department of Karma. No doubt, very good academician. They are very good having clinical exposure and vast knowledge and abundant knowledge and uh, uh, enormous energy, and they are great scholars. I hope at the end of each session, no doubt, all the students will be having very fruitful exchange. They gain knowledge that will be very useful and informative for all the teachers and students. I wholeheartedly thank all the speakers who have accepted our invitations. You have agreed to share their knowledge on this platform of webinar. No doubt webinars are become webinar. It is an era of webinar. This platform is really a great platform so that all the students can get or gain knowledge listening to various eminent scholars throughout the country. I wholeheartedly thank Head of the Department of Panchakarma for giving me an opportunity to share few things on this day. Thank you and all the very best for the Postgraduate Department of Panchakarma for the series of this webinar. Thank you.
Thank you, ma'am, for your short blueprint of all the sessions as well as the keynote address. Thank you, ma'am. Now I request today's chief advisor of the event, Dr. Rajshekar Gangir sir, to share few views about the session. Hello,
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ತಾರನಾಥ್ ಸರ್ಕಾರಿ ಆಯುರ್ವೇದ ವೈದ್ಯಕೀಯ ಮಹಾವಿದ್ಯಾಲಯದ ಸ್ನಾತಕೋತ್ತರ ವಿಭಾಗದಿಂದ ಆಯೋಜನೆ ಮಾಡಿರುವಂತಹ ಈ ವೆಬಿನಾರ್ ಕಾರ್ಯಕ್ರಮ ಭಾಗವಹಿಸಿರುವಂತಹ ಎಲ್ಲ ಪಂಚಕರ್ಮ ವಿಭಾಗ ಮತ್ತು ಆಯುರ್ವೇದದ ಕ್ಷೇತ್ರದ ವಿವಿಧ ರಾಜ್ಯದಿಂದ ಮತ್ತು ವಿವಿಧ ಭಾಗಗಳಿಂದ ಈ ಒಂದು ವೆಬಿನಾರ್ ಕಾರ್ಯಕ್ರಮವನ್ನು ವೀಕ್ಷಣೆ ಮಾಡ್ತಾ ಇರತಕ್ಕಂಥ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಕೂಡ 129ನೆಯ ಪಂಡಿತ್ ತಾರನಾಥರ ಜಯಂತಿಯ ಶುಭಾಶಯಗಳು. ನಮಗೆಲ್ಲ ಗೊತ್ತಿರುವ ಹಾಗೆ ಪಂಡಿತ್ ತಾರನಾಥರು ಈ ಆಯುರ್ವೇದ ಕ್ಷೇತ್ರದ ಒಬ್ಬ ದಿಗ್ಗಜರಾಗಿ ಅಜರಾಮರವಾಗಿ ಉಳಿದಿರತಕ್ಕಂಥ ಹೆಸರು. ಹಾಗೇನೆ ತಾರನಾಥ್ ಸರ್ಕಾರಿ ಆಯುರ್ವೇದ ವೈದ್ಯಕೀಯ ಮಹಾವಿದ್ಯಾಲಯ ಒಂದು ಐತಿಹಾಸಿಕ ಹಿನ್ನೆಲೆಯನ್ನ ಹೊಂದಿರತಕ್ಕಂಥ ಒಂದು ಮಹಾವಿದ್ಯಾಲಯ. ಅದರಲ್ಲೂ ವಿಶೇಷವಾಗಿ ಈ ಪಂಡಿತ್ ತಾರನಾಥ್ ಸರ್ಕಾರಿ ಆಯುರ್ವೇದ ವೈದ್ಯಕೀಯ ಮಹಾವಿದ್ಯಾಲಯದಲ್ಲಿ ಪಂಚಕರ್ಮಕ್ಕೆ ಒಂದು ವಿಶೇಷ ಮೆರಗನ್ನ ಕೊಟ್ಟಿರತಕ್ಕಂತಹ ಡಾಕ್ಟರ್ ಎಂ ಈಶ್ವರ ರೆಡ್ಡಿ ಅವರು ಕೆಲಸ ಮಾಡಿರ್ತಕ್ಕಂಥ ಮಹಾವಿದ್ಯಾಲಯ. ಇದು ಅವರ ಕರ್ಮಭೂಮಿ ಕೂಡ ಹೌದು. ಈ ಮಹಾವಿದ್ಯಾಲಯದಲ್ಲಿ ಕಳೆದ 2 ವರ್ಷಗಳಿಂದ ಪಂಚಕರ್ಮ ಸ್ನಾತಕೋತ್ತರ ಒಂದು ವಿಭಾಗ ಪ್ರಾರಂಭವಾದ ಮೇಲೆ ಸಾಕಷ್ಟು ಚಟುವಟಿಕೆಗಳನ್ನ ಗರಿಗೆದರಿ ನಿಂತಿರ್ತಕ್ಕಂಥದ್ದನ್ನ ನಾವು ನೋಡಿದೀವಿ. ಪಂಚಕರ್ಮ ಅನ್ನುವಂಥದ್ದು ತಾರನಾಥ್ ಸರ್ಕಾರಿ ಆಯುರ್ವೇದ ವೈದ್ಯಕೀಯ ಮಹಾವಿದ್ಯಾಲಯಕ್ಕೆ ಯಾವುದೇ ಹೊಸ ವಿಷಯ ಮತ್ತು ಹೊಸ ಇದು ಅಂತ ಅನಿಸದೇ ಇದ್ರು ಕೂಡ ಇವತ್ತು ಈ ಸ್ಪರ್ಧಾತ್ಮಕ ಯುಗದಲ್ಲಿ ಸಾಕಷ್ಟು ಬದಲಾವಣೆಗಳನ್ನ ನಾವು ನೋಡಿದೀವಿ. ಮುಂಚೆ ನಾವು ಕೇವಲ ಸೆಮಿನಾರ್ಗಳನ್ನು ನೋಡ್ತಾ ಇದ್ವಿ. ಇವತ್ತು ವೆಬಿನಾರ್ಗಳ ಯುಗದಲ್ಲಿ ಇವತ್ತು ಮನೆಯಲ್ಲೇ ಕುಳಿತುಕೊಂಡು ನಾವು ಅಧ್ಯಯನವನ್ನ ಮಾಡ್ತಕ್ಕಂಥ ಈ ಕಾಲದಲ್ಲಿ ಇವತ್ತು ಬೇರೆ ಬೇರೆ ಭಾಗಗಳಲ್ಲಿ ವೆಬಿನಾರ್ ಆಗ್ತಾ ಇರತಕ್ಕಂಥದ್ದು ಇದೊಂದು ಕ್ರಾಂತಿ ಅಂತಾನೆ ನಾನು ಹೇಳೋದಕ್ಕೆ ಇಚ್ಛೆ ಪಡ್ತೀನಿ. ಕೇವಲ ವೆಬಿನಾರ್ಗಳು ಅಂತಾರಾಷ್ಟ್ರೀಯ ಮಟ್ಟದಲ್ಲಿ ಸಾಫ್ಟ್ವೇರ್ ಕಂಪನಿಗಳು ಮಾತ್ರ ಮಾಡ್ತಾ ಇದ್ದಂತ ಈ ಒಂದು ಸಂದರ್ಭದಲ್ಲಿ ಅದು ಕೊರೋನಾ ಯಾವ ಗಳಿಗೆಯಲ್ಲಿ ಬಂತೋ ಗೊತ್ತಿಲ್ಲ, ಇವತ್ತು ವೆಬಿನಾರ್ಗಳು ನಡೀತಕ್ಕಂಥದ್ದು ಆಯುರ್ವೇದದಲ್ಲಿ ಸರ್ವೇ ಸಾಮಾನ್ಯವಾಗಿರೋದನ್ನ ನಾವು ನೋಡ್ತಾ ಇದ್ದೀವಿ. ಹಾಗೇನೆ ನಮ್ಮ ಮಹಾವಿದ್ಯಾಲಯದ ಅಧ್ಯಾಪಕರು ಕೂಡ ಸಂಪೂರ್ಣವಾಗಿ ಕೊರೋನಾ 19 ಒಂದು ಮುಂಜಾಗ್ರತಾ ಕ್ರಮ ಮತ್ತು ಅದಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತಹ ಬೇರೆ ಬೇರೆ ಕ್ರಮಗಳಲ್ಲಿ ಅವರು ತಮ್ಮನ್ನು ತಾವು ತೊಡಗಿಸ್ಕೊಂಡಿದ್ರು. ಎಲ್ಲಾ ಇಲ್ಲಿರ್ತಕ್ಕಂಥ RRT ತಂಡದಲ್ಲಿ ಸರ್ವೇಲೆನ್ಸ್ ಕ್ಷೇತ್ರದಲ್ಲಿ ಎಲ್ಲ ಕೆಲಸ ಮಾಡಿಕೊಂಡು ಇವತ್ತು ಮತ್ತೆ ವೆಬಿನಾರ್ಗಳನ್ನ ಆಯೋಜನೆ ಮಾಡೋದ್ರ ಮುಖಾಂತರ ಈ ತಾರನಾಥ್ ಆಯುರ್ವೇದ ಮಹಾವಿದ್ಯಾಲಯದ ಒಂದು ಪರಂಪರೆ ಏನಿದೆ, ಜ್ಞಾನವನ್ನ ಹಂಚುವಂತ ಒಂದು ಪರಂಪರೆ ಏನಿದೆ, ಆ ಪರಂಪರೆಯನ್ನ ಮುಂದುವರಿಸ್ತಕ್ಕಂಥ ಒಂದು ಕೆಲಸವನ್ನ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಡಾಕ್ಟರ್ pervaje ಅಂತಕ್ಕಂಥ ಶ್ರೇಷ್ಠವಾಗಿರ್ತಕ್ಕಂಥ ಒಬ್ಬ ಆಯುರ್ವೇದ ತಜ್ಞರು, ಇವತ್ತು ಅಂತಾರಾಷ್ಟ್ರೀಯ ಮಟ್ಟದಲ್ಲಿ ಹೆಸರು ಗಳಿಸಿರ್ತಕ್ಕಂಥ pervaje ಅವರ ಬಗ್ಗೆ ನಮ್ಗೆಲ್ರಿಗೂ ಗೊತ್ತಿರುವಂತದ್ದೇನೆ. ಅವರು ಪುತ್ತೂರು ಅನ್ನುವಂತ ಒಂದು ಚಿಕ್ಕ ಒಂದು ಊರಿನಲ್ಲಿ ಒಂದು ಅಂತಾರಾಷ್ಟ್ರೀಯ ಮಟ್ಟದ ರೋಗಿಗಳನ್ನ ತಮ್ಮತ್ತ ಸೆಳೆಯತಕ್ಕಂಥ ಮತ್ತು ಈ ಭಾರತ ದೇಶದಲ್ಲಿರ್ತಕ್ಕಂಥ ದೊಡ್ಡ ದೊಡ್ಡ ಆಯುರ್ವೇದ ವಿದ್ವಾಂಸರಿಗೆ ಒಂದು ಸವಾಲಾಗ್ತಕ್ಕಂಥ ಪ್ರಕರಣಗಳನ್ನ, ರೋಗಿಗಳನ್ನ ಗುಣಪಡಿಸಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ pervaje ಅವರನ್ನ ಈ ಒಂದು ವೇದಿಕೆಗೆ ಕರೆಸಿರ್ತಕ್ಕಂಥದ್ದು, ಅವರಿಂದ ಲಾಭವನ್ನ ಪಡ್ಕೊಳ್ತಕ್ಕಂಥದ್ದು ನಮ್ಗೆಲ್ರಿಗೂ ಕೂಡ ಒಂದು ಉತ್ತಮವಾಗಿರ್ತಕ್ಕಂಥ ಅಂಶ. ನಾವೆಲ್ಲರೂ ಕೂಡ ಅದರಿಂದ ಲಾಭವನ್ನ ಪಡೆದುಕೊಳ್ಳೋಣ. ಮತ್ತು ಈ ಒಂದು ಮುಂದೆ ಬರ್ತಕ್ಕಂಥ ಅವಧಿಯಲ್ಲಿ ಏನು ಈ ವೆಬಿನಾರ್ಗಳು ನಡೆಯುತ್ತೆ, ತಜ್ಞ ವೈದ್ಯರುಗಳು ಬಂದ್ಬಿಟ್ಟು ಇದರಲ್ಲಿ ತಮ್ಮ ಜ್ಞಾನದ ಒಂದು ವಿಷಯಗಳನ್ನ ಇಲ್ಲಿ ಪ್ರಸ್ತುತಪಡಿಸ್ತಾ ಇದ್ದಾರೆ. ನೀವೆಲ್ಲರೂ ಕೂಡ ಅದರ ಜ್ಞಾನವನ್ನು ಸದುಪಯೋಗ ಮಾಡ್ಕೋಬೇಕು ಅಂತಕ್ಕಂಥ ಮಾತನ್ನ ಈ ಸಂದರ್ಭದಲ್ಲಿ ಹೇಳ್ತಾ, ಈ ಒಂದು 2 ವಿಚಾರಗಳನ್ನ ತಮ್ಮ ಮುಂದೆ ಇಡೋದಕ್ಕೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಸನ್ಮಾನ್ಯ ಪ್ರಾಚಾರ್ಯರಂತ ಡಾಕ್ಟರ್ ಸೈಯದ್ ಅಖ್ತರ್ ಫಾತಿಮಾರ್ ಅವರಿಗೂ ಮತ್ತು ನಮ್ಮ ಪಂಚಕರ್ಮ ಸ್ನಾತಕೋತ್ತರ ವಿಭಾಗದ ಮುಖ್ಯಸ್ಥರಾಗಿರ್ತಕ್ಕಂತಹ ಡಾಕ್ಟರ್ ದೊಡ್ಡಬಸಯ್ಯ ಕೆಂಡದಮಠರವರಿಗೂ ಮತ್ತು ಅದರ ಸಹ ಪ್ರಾಧ್ಯಾಪಕರಾಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ರಾಜೇಶ್ ರವರು ಮತ್ತು ಎಲ್ಲ ಸ್ನಾತಕೋತ್ತರ ವಿದ್ಯಾರ್ಥಿನಿಯರಿಗೆ ನಾನು ತುಂಬ ಹೃದಯದ ಅಭಿನಂದನೆಗಳನ್ನು ಸಲ್ಲಿಸ್ತಾ, ಈ ಒಂದು ವೆಬಿನಾರ್ನ ಒಂದು ಲಾಭವನ್ನ ಎಲ್ಲರೂ ಕೂಡ ಪಡೆದುಕೊಂಡು ಪಂಚಕರ್ಮವನ್ನು ಅಂತಾರಾಷ್ಟ್ರೀಯ ಮಟ್ಟಕ್ಕೆ ತೆಗೆದುಕೊಂಡು ಹೋಗ್ತಕ್ಕಂಥ ಕೆಲಸವನ್ನ ನಾವೆಲ್ಲರೂ ಕೂಡ ಮಾಡೋಣ ಅಂತಕ್ಕಂಥ ಒಂದು ಸದಭಿಲಾಷವನ್ನ ಈ ಸಂದರ್ಭದಲ್ಲಿ ವ್ಯಕ್ತಪಡಿಸಿ ನನ್ನ ಮಾತಿಗೆ ವಿರಾಮ ಕೊಡ್ತೇನೆ. ಭಾರತ್ ಮಾತಾ ಕಿ ಜೈ.
About today's guest speaker, Dr. Ravishankar Pervaje, sir. I welcome Shweta.
A very good evening to everyone. I once again welcome you all to today's session of the first session of our webinar series, Karma Sadhana. We have today the well-renowned person in surgery department of Ayurveda, Dr. Ravishankar Pervaje, sir, who was born on 30th of April in the year 1962. Sir have completed their BMS from Ayurveda College of Udupi in the year 1985. Sir have completed from Masters in Surgery in Banaras Hindu University in the year 1989. And sir have joined as a profession as a surgeon and as an Ayurveda physician at Puttur in the year 1989. In 1991, sir developed a Pratisaraniya Kshaраkarma and Agni Karma in different conditions like piles, fistula in ano, fissure in ano and rectal prolapse, pilonidal sinus, carcinoma in situ and non-healing ulcers. Sir have presented various and conducted various workshops over Kshaраkarma and Agni Karma since have been conducting from the year 1999 till today. Sir have worked as a visiting faculty at SDM Ayurveda College from 2001 to 2004. Have published the research papers on Kshaраkarma and Agni Karma in NIMA journals in 2002 and Ayurmed line in 2002. Sir is a well-renowned, sir have n number of students practicing on his own unique principles of Ayurveda with more of success rates. Sir have conducted workshops on Kshaраkarma and Agni Karma and sir gave guest lecture and seminars on different colleges of Ayurveda on Kshaраkarma, Agni Karma. Sir have presented mainly on acute stroke syndrome, a subject management from in Government College of Indian Medicine and Centenary Celebrations by Mysore, and presented guest lecture on management of acute stroke management in Bangalore Vidyapitha. Sir also conducted many camps, has been conducting many of the camps over Kshaраkarma and Agni Karma especially, and today we have a beautiful topic to be discussed in our department by Dr. Pervaje sir. I request sir to give the session and I request everybody to get a very good use of this session. Thank you sir. Over to you sir. Thank you.
Pandit Taranath ji, and he is a great guru, and you can say. So it is a great honor for me. You have gave to give to share my experience. So, with the thanking this, I will go directly to presentation. Now, already half an hour is over. I may take at least 1 hour 15 minutes. Okay. So, management of acute stroke by Ayurveda based on Karya Karana Siddhanta. Stroke is, as you know, it occurs due to hemorrhagic or occlusive. Occlusive again, infarction by intra thrombosis. So on. And it may present as transient ischemic attack, lacunar infarction, infarction of anterior, middle, and posterior cerebral artery. So stroke means usually a patient evaluation stroke means patient comes just a weakness in the side of the body and he goes into complete hemiplegia. It all related to area involved, minor to major, vessels involved, both in hemorrhage and infarction. So prognosis is according to age, old age bad prognosis and according to area involvement. A big area involved, it is bad prognosis, small area involved, very good prognosis. So what happens in stroke is a small area, complete death of the tissue occurs. Due to this dead tissue, due to hemorrhage or infarction, due to this there is a big area of inflammation. This inflammatory area of congestion decrease the blood supply. How much fast we reduce the inflammation, that much fast congestion reduces. Good. If you treat properly, this inflammatory swelling, naturally congestion comes down. If you treat wrongly, this inflammation increases, so congestion increases, and this dead tissue also increases. Patient comes walking vertically to your hospital, he goes from hospital horizontally if you don't treat correctly. So, resultant presentation by this, how patient presents you, they present with the just disorientation, unconsciousness, or coma, and there will be convulsions and weakness in contralateral part of the body, and there will be hemiplegia. Usually, sometimes they present with death also. Usually, there will be increased blood pressure, but it is not always true. Sometimes the patient may have, due to shock, there will be decreased blood pressure also. This is all according to age and area of involvement. So management is in hemorrhage, just you are treating the condition symptomatically by IV fluid, RT feeding, Foley's catheter, oxygenation, diuretics, antihypertensive, etc. Patient may recover or may not recover with the and abscess, encephalitis, or malignant growth or traffic accidents. These conditions also comes to us with the stroke-like syndrome. So, when you treat such conditions, if it is infective conditions, you have to give treatment for infections, or growth is there, some road traffic accident, you may go for surgical intervention. So, am I audible, sir? Hello?
Yes, sir.
Yes. So you are seeing the this was my PowerPoint presentation also, I think.
Yes, sir. We can see, sir. Yes, sir.
Okay. So I will proceed further. So these are all Western medicine management, Western medicine concepts of stroke. Now, how it should be treated according to Ayurveda? Should you give for a modern diagnosis, making some Sanskrit names and give herbal mineral drugs? Is it Ayurveda? What is actually Ayurveda means? So, to understand this one, Then Charaka says a shloka, famous shloka is in first chapter Charaka. Hetu lingaushadam jnanam swasthatura parayanam. Patients presents us with the linga, signs and symptoms. That is effect, karya. You have to find out its hetu, cause. Then aushada should be given to the cause and also effect also. So this is that means the Ayurveda is the whole Ayurveda concept is based on cause and effect siddhanta, karya karana siddhanta. Even Western medicine also based on same concept. Then what is the difference? Difference is how you are on which logic you are analyzing the cause. There comes the difference. Signs and symptoms is same for Western medicine or Ayurveda, because patient comes with the same signs and symptoms. So only we have to find out the cause according to Ayurveda or according to Western medicine. Western medicine, they are explaining according to their concept. It's okay. According to Ayurveda, how we should analyze? According to Ayurveda, you see, any roga, nasti rogo vina dosha, yasma tasma vichakshana. There is no roga without any dosha. Sorry for disturbance. So there is no roga without dosha. Like that, anuktamapi, even it is not told, doshanam linga vyadhim pacharet. You have to see doshanam linga, where in vyadhi. In vyadhi you see dosha linga, then give the treatment. This is the basic principle of Ayurveda. All the concepts, all the cause, we have to analyze according to dosha. Even nasti rogo vina dosha means it has another meaning. Nasti arogo vina dosha. When doshas are in samya avastha, there will be aroga. When doshas are in vishama avastha, there will be roga. When the dosha vaishamya occurs, there will be roga. So roga means they will. So by kala artha karmanam yogo hinamithyati matrika, by these causes, this kalatrikam yogo hinamithyati matrika, this cause is same for Western medicine or Ayurveda. The thing is, according to Ayurveda, we are analyzing by this, there will be ruddhi and kshaya of doshas. By that, if it is ruddhyaka prasara samshaya vyakta of the vyadhyakars, we are analyzing everything on the basis of three doshas. That is why in Charaka says in Vatavyadhyadhyaya, hetu sthana vishesha bhaved roga vishesha. The differential diagnosis of different vyadhis we have to do according to hetu vishesha and according to sthana vishesha. Hetu vishesha means, here you see, hetu vishesha means pitta avarnadi, yatha vata dushti. Is it pitta avarna, is it kapha avarna, is it rakta avarna, yatha. Sthana vishesha, yatra sthana samshaya, koshtani. In the context of pakshagata, sthana vishesha is marmasthana, shiro marmasthana. You see. So, if you see in the sthana vishesha analysis, pakshagata, if you see hatvaika maratam paksham daksham, one-sided weakness, loss of speech and loss of sensation of pain. This is the signs and symptoms. What happens in this one? Tiryagata dhamani. A prakubita matarishya, prakubita vatadosha gets samshaya tiryagata dhamani. Then what happens? Anyatara sandhi vibhandhakas. Other side it goes. So sthana samshaya, where it occurs? At tiryagata dhamani urdhva dehaga. That is sthana samshaya. So when akshepak occurs, muhur akshepa, again and again there will be samshaya and release. That is why then there will be akshepaka. So now coming to this here, prakopita vata gets sthana samshaya comes. This prakopa of vata occurs different way. Hetu vishesha will be different. Yatha dushtena doshena, that we have to analyze. How many types of, then how this pakshagata becomes how many types? Usually, most of students tell pakshagata is one type, it is nanatmaja vyadhi. That is what they say. But what Sushruta says, Shuddha vata hatam paksham kritasadhyatam vidu sadhyam anye sansushtam asadhya hetukam asadhyam kshaya hetukam. What do you mean by that? Now you see, one is Shuddha vataja, that is kevala vataja, kritra sadhya. Anya dosha samsrita becomes pitta samsargaja, kapha samsargaja, both pitta and kapha samsargaja. That again three types of here. And the Dhatu Kshayaja, Kshaya Hetuka. Now, what do you mean by this Kshaya Hetuka? One is Kevalavataja, another is Kshaya Hetuka. Or Kevalavata also, there should be a Dhatu Kshaya. What is the difference? Then Jayajata says, what he says, Ye Shonita Ati Sruti Krita Dhatu Kshayaja. That is asadhya. Now, usually when you see this line, people start to think that Shoniyati Sruti Krita means intracerebral hemorrhage. Actually, it is not intracerebral hemorrhage. Intracerebral hemorrhage now you are seeing because of CT scanning or MRI scanning. At the time of Sushruta, there was no CT scanning or MRI scanning. At that time, what happens? War was going on, wound was going on. There will be severe bleeding from the body. When it occurs, Shonita Shruti occurs, patient goes into cerebrovascular accident state, that semi-conscious, unconscious state, in the CVA state. In that state, is a Pakshagata is asadhya, not intracerebral hemorrhage. Whereas Balavadi Vigrahadi, Viruddhahara Vitakrita, whatever Raktadushti Ratanat Prakopa Pakshagata occurs, that is Kevala Vataja, that is Kritya Sadhya. Whereas Pitta and Kapha Samsargaja is there, that is Sulabha Sadhya. If you see in ICU, neurological ICU, when acute stroke comes to you, with the symptom of one-sided weakness and semi-conscious or unconscious state, if you see the cases, you will find out when this is Pitta and Kapha Samsargaja state, in that state, should you treat or not? Usually we do refer such cases to Western medicine centers. But Sushruta, since said this condition is Sulabha Sadhya, why we should not treat? For that we should know what do you mean by Pitta Samsarga or it is Kapha Samsarga. So that is why Bhavaprakasha said, when Daha Santapa Murcha Siyovayo Pitta Samanvite, Daha Santapa Murcha is there in a Pakshagata patient, then that is a Pitta Samanvaya. Whereas Shaitya Shotha Gurutvan, this symptomatology is there in a Pakshagata, along with Pakshagata, that is a Kapha Samanvaya. When if you see in ICU, most of the patient comes with the Murcha or Madha state, that is Pitta Samanvaya, or heaviness and numbness, that is Kapha Samanvaya. In that state, when patient comes, why we can't treat with Ayurveda? They have said it is Sulabha Sadhya. Now, for that we have to analyze this patient comes with the murcha. This we have to analyze this. What is this murcha? Murcha again. This in murcha state we can't make this. If a patient of stroke with the infarction, they usually have a kapha symptoms, whereas patients of stroke due to hemorrhage, they usually have pitta symptoms. But don't make it a rule. But according to it may be infarction, they may have krodha prushabhasya, then diagnosis pitta only. A hemorrhage patient may have kapha symptoms, asambandha alpoja, then diagnosis as kaphaja. Don't go by hemorrhage or infarction, but go by your presenting symptom, then diagnose and you have to select the treatment. The treatment aspect I will tell later. Then how this murcha sanya, madamur sanyas occurs is by rasa rakta manosrosa get avarana by tamodosha. There will madamur sanyasa yathottaram baladikyam hetu linga upashantishu. Mada is very less this one pathogenic, whereas murcha is madhyama and sanyasa is very severe and very difficult to cure. When a patient may come with any signs and symptomatology with pakshagata. So till now we have analyzed the sthana vishesha. If sthana samshaya at Tiryagadamani Urdhvadehaga, then you will have all these symptoms that you can find out. Now coming to Hetu Vishesha, here Prabhvita Vata gets answer, you understood. Now how Prakopa occurs, Hetu Vishesha, Yatha Vata Dushti, that we have to understand to give a treatment. So Hetu Vishesha will be, Vata Prakopa will be Dhatukshayat Kopo Margasya Avarenacha. Vata Prakopa either due to Dhatukshaya or by Margavarana. Then comes a Cha. Cha means what? Dhatukshaya due to Margavarana. So a patient may come with a Pakshagata by Dhatukshaya Vata Prakopa, by Margavarana or Dhatukshaya due to Margavarana. Now what is this? by ruksha shita viruddhahara viharas, dhatukshaya occurs, vata prakop, deshthana, you get a disease. This one. And one is margavarana. Kapha, pitta, rakta, mamsa, meda, asti, madhya, shukra. All these things can block the movement of vayu. Then vata prakopa gets samsha, you get a disease. This is another type. When you see here, this kapha, pitta, avarana, janya vyadis will be sarvadhika. But rakta, avarana, janya vyadi will be ekadesha, just like pakshagata. And mamsa, avarana, meda, avarana, these vyadis will be in that particular srotas. So like this Prakupitavata gets Asamsha anywhere. Amashayagata, Pakvashandhigata, Marmagata, anywhere in the body. In the context of Pakshagata, it will occur, Stansamsha occur at Tiryagadamani Urdhvadehaga. So initially, Cha means initially there will be Avarana symptom more, Dhatuksha symptoms less. As the time passes on, slowly Avarana symptom comes down, Dhatuksha symptoms will take over. So initially, if you see a Pakshagata patients, when initially comes to you, they will have all avarana symptoms, weakness, loss of function, loss of movement, and pain, everything will be there. But there is no degeneration of the limbs. Okay. After some time, if you see, this avarana symptom is okay. Along with that, dhatuksha symptom, the whole one-sided muscles are become degenerated, completely degenerated. Dhatuksha symptoms will take over. So, when the patient comes in Dhatuksha state, your treatment should be Brahmana. When patient comes in Avarana state, your treatment should be Karshana Chikitsa. By, you have to see Avarana by what, then you have to do Karshana Chikitsa accordingly. That is why Charaka says, Avastha Vashena Chikitsam Kuryat. In which avastha, patient may come with 90% or 10% Dhatuksha, may come with 50% or 50% Dhatuksha, or may come with 10% avarana, 90% Dhatuksha symptoms may be there. Everything you have to analyze and give the treatment. That is why this understanding is very important. To understand this one, you can have a understand by a simile. For example, a river is there. Tungabhadra river is there in your place. Water is flowing. What happens in summer? Whole river becomes dry from Moola Srotas itself. Then water-filled area is filled with the water. There is a dry land filled with the air. That is Dhatuksha Vata Prakopa. Then another thing is Avarana. If you put there is a Tungabhadra dam is there, Hospete. Any this one, Kapha, Pitta, Rakta, Mamsa, Meda, Asti, Madhya, Shukra, anything can get the blockage. Then there will be elevation of water level. That is the moving force is increased. That is Avarana Vata Prakopa. This Vimargamana occurs, you get a disease. Okay. Then what happens below stream? Due to this Avarana, below stream your river becomes dry. That is why this dry occurs, because of Avarana. That is a Cha, Avarana Dhatukshaya. Patient may come with Avarana state, Dhatukshaya state, or initially from Dhatukshaya. All things we have to analyze. When Avarana is there, you have to analyze Avarana by what? Kapha, Pitta, Rakta, Mamsa. Accordingly, your treatment will be. So I hope you understood this concept. This is very important concept when you understand the treatment. So this is mathematics, but since you are treating, you have to understand how you will understand. This is Pittavarana. In Pittavarana, symptom will be Daha Krishna Shulam Brahmastamaha. Shula is Vata symptom, all other Pitta symptoms will be there. Katvam Loshna Vidaha Shita Kamita. And Kaphavarana Shaitya Shota Gurutvani. Shula is Vata symptom, other Kapha symptoms will be there. These Kapha and Pittavarana symptoms, if you see, they are all Sarvadhika. But in context of this Pakshagata, this is Ekadeshaja. How it can occur? Then for that we have to understand Raktavarana. In Raktavarana, what happens? Sadaha arti tuklam santarajo brisham bhabe saraga shayathu jayante mandalancha. There will be daha, pain in between Tvakka and Mamsa, raga, redness, and mandalani shayathu. Mandalani shayathu is Ekadesha, there will be mandalani shayathu. So here question comes, what do you mean by pain in between Tvakka and Mamsa? For that, Sushruta used the word Sparshadvesha. Sparshadvesha is tenderness. So any area wherever Raktavarana occurs, it can happen not in all our body. Any area in the body it can happen. So when it happens, you have to find out Mandalani Shvayatu is there and Shula is there and Sparshadvesha is there. That occurs due to Raktavarana Vata Prakopa. Now it becomes, as a clinician, it becomes very useful when a patient comes with any painful condition, any condition of Vata Vyadhi, just you touch him, press his body. If there is a severe pain, that area, that you can understand it occurs due to Sparshadvesha. By Sparshadvesha, you can understand it occurred due to Raktavarana. Your treatment will be Rakta Prasana or Rakta Amapachana or Rakta Mokshana. Then you have to go for other treatment. So, to understand how this Raktavarana can happen in your body, to understand this one, Charaka says in Vatarakta Dhyaya, what happens? This Vayu and Rakta, both are moving entities. But how one moving entity can block another moving entity? If you see, compare this Vayu is Sukshma and Chala, Rakta is Sara and Drava. Compare Vayu and Rakta. Rakta is Sthula compared to Vayu. Vayu is Sukshma compared to Rakta. Yeah, whenever a heavy one will block the Sukshma one. So, to understand this one, there is a traffic. In a highway, heavy vehicles are going and small vehicle, bike, scooters, everything is going. Anywhere a road is blocked, a Rakta Srota is blocked, or Rakta, heavy vehicle, if it is blocked, Dushti happens, it's blocked. Still you negotiate your bike, you see, if a heavy vehicle is there. After some time, 3-4 lorry bus comes, it stops, then your bike also will not go. So first Rakta stops, then Rakta will block the movement of Vayu. There will be accumulation of vehicles. Mandalani Shvayatu. And loss of function, heated exchange between drivers, daha, pain, everything will occur. Immediately, if you remove this avarana block, it is okay. If you don't remove, the informer goes to city center, the whole city temperature like that, whole body temperature increases. If you see this daha, raga, shodha, shula and sparshadesha, these are nothing but sign symptoms of inflammatory swelling according to modern system of medicine. We call it as gunashodha. It can happen anywhere in the body. To happen this, there should be karanas. Because Rakta Dushti should happen. Rakta Dushti, always it is not a Rakta cannot block Vayu because Rakta is a Dhatu. Vayu is dosha. A dosha cannot be blocked by Dhatu by itself. For that, it needs doshas. So, by ahara, vihara, all these things, Rakta Dushti occurs according to Kapha, Pitta and Vata, then only it can block the movement of Vayu. If you see Rakta Dushti Karanas here in Charaka Samhita, 24th chapter, Vidishonitya Dhyaya, what he says, Pradushta, Bhautikshnoshne Madhyenme Tatvidahi, Atilavanaksharai, Amlai, Katubirevacha. This first line is Pitta Swarup Rakta Dushti Karana. Smoking, alcohol taking, all these things may cause Rakta Dushti, Raktavanavata Prakapa, you may have a Pakshagata. It is a known thing. And second and third is Kapha Swarup Rakta Dushti Karana. Kulattama, Nishpatilata, Nishayane, Mindal, Mulakane, Redana Sarvasha, all Kafaja, Dadi, Mastu, Surasavi, all these things, Kapha Swarup Dushti, Raktavarana, Vata Prakopa. Fourth line, Virdahara, Chadivega Pradigata, these are all Kapha Swarup Rakta Dushti Karana. So when by this ahara vihara raktushti raktavanavata prakopa occurs, this prakopa gets samshaya triyagadam urgodehaga, you get a pakshagata. If it is pitta swarup raktushti raktavanavata prakopa, you will have pitta symptoms. Kapha swarup raktushti raktavanavata, you will have kapha symptoms, kapha samandvita. If vata swarup raktushti raktavanavata prakopa getting a pakshagata, you will have kevala vataja symptom, kevala vataja. Then it becomes kritra sadhya. Whereas Kapha Pitta will have, you will have Sulabha Sadhya. Then in last line, it can occur by Abhigata. Abhigata is injury. By road traffic accident. It will happen, you can see in day-to-day life. And other than this, there will be many diseases. Other than this, can happen by Rakta, Adhishtanya, Prayo, Vikaran, Janita. There is Rakta Jakrimis by infections. Tubercular infection or other infection, encephalitis, or abscess, intracerebral abscess. That may cause also a pakshagata and akshepaka can happen. When this, as it is clear now that Raktar Vata Prakopa leads to Runashota, which can occur anywhere in the body, you will have, it can happen in this, you will get Runashota, this by this Prakupita Vata gets Ansamshaya at Twak, Mamsa, Sira, Snaya, Sandhi, Asti, Marma Ghost anywhere. In the context of Pakshagata, it occurs at Shiromarma. Shiromarma. Since this is occurring in the Raktadushti Janya, Vyati, that is a Sushruta used the word for this Pakshagata is Doshabhigataja Marmabhigata, Doshaja Marmabhigataja, Pakshagata, Doshaja Marmabhigataja. By Abhigata it can happen, by Dosha Dushti, Doshaja Marmabhigata. By Krimi also it can happen. So by all three means it can happen. When it occurs due to Abhigata, road traffic accident, you may need Shalya Chikitsa if Shalya is there. If Doshaja Marmabhigata, treatment should be Sushruta said that, put that word, coined that word because it is such a serious thing, acute state. So your treatment will be Doshamapachana Chikitsa. If it is due to Krimi, what should be your treatment? So treatment will be Krimi Chikitsa. Krimi Chikitsa is Apakarshana, Nidana Parivarjana and Prakriti Vighat Chikitsa. One is Nidana Parivarjana, okay, you do Nidana Parivarjana. Then Apakarshana is all Panchakarmas. And Prakriti Vighata means killing of the krimis. Before advancement of microscope. So Abhigata, Raktaja Krimi, Raktanavata. So before advancement of microscope, these things are done by Anumana Pramana. After as science advanced, microscope is advanced, you can find out which krimi is involved. So you find out which krimi is. Then to killing the krimi, there are many medicines are developed. After 1940, when antibiotics all came, it's a hetu viruddha chikitsa. You have to kill the krimi. So whenever krimija, this tubercular nodule is there or encephalitis is there, you have to give antibiotic to kill the krimi. Then you have to go for amapachana chikitsa. Before advancement of microscope, this is done by Anumana Pramana. After advancement microscope, after advancement of your antibiotics, you can kill the krimi directly because krimi is the hetu. Then only you can do amapachana. Unless you do amapachana, if you are doing krimi prakriti, if you give the treatment continuously, krimi always continuously produces ama. How much you remove apakarshana, krimi produces. Unless you remove this krimi by this antibiotic, patient usually will not survive. Because of this advancement, you can cure many of the cases now. So with this understanding, so for this krimi chikitsa, then you will ask, Sushruta has not told anything. Sushruta told many drugs. Surasadi Gana is there. Saptaparna, Karanja, Nimba, Rayantvajaha, Gomutra, Ksharodaka, many drugs are there. In vitro, it works excellently. We have doing treatment daily with this for any diabetic wounds, other wounds, infective wounds. But for in vivo, after taking medicine inside, when it goes to blood, we don't know how it works. This is a matter of research. I think your education institutes can go for such work later. So, so I hope you understood this infection theory in Ayurveda. Now here question arises, why Sushruta has not told this concept in first chapter itself. He has told in the 56th chapter of Uttara Tantra. Why it is not told previously? But according to Ayurveda, the cause of disease is not krimi. According to Ayurveda, the cause of disease dosha vaishamya, not krimi. Why? Because you see, if you see my body, there are crores of bacteria me, but I don't get any disease. Why? Why I don't get any disease? Because I am in Samadoshavastha. I am in Samadoshavastha. When I am in Samadoshavastha, your krimi will not do anything. If by ahara vihara dosha vaishamya occurs, then only infection can cause the disease. I hope you understood this concept. That is why Sushruta Charakacharya or ancestors, they have told cause of disease is dosha vaishamya, not krimi. But once krimi is invaded, unless you remove the krimi, how much amapachana you do for dosha getting so dosha samyata, it is not possible. If it is by abhigata, you have to treat the Abhigata according to by Shalya Chikitsa. So now here question arises about this infection theory again. One of my friend asked me, you have all Vyadikshamatva increasing drugs, Rasayana Chikitsa. Should take all Rasayana Chikitsa. You get to attain good Vyadikshamatva. Then he asked me, if you get such a good Rasayana and Vyadikshamatva, if I give one ampoule of injection of HIV virus, are you going to take it? Then I told him it is not possible. He asked me why. Then I told, if you give it to drink, I can drink, but if you give injection, I can't. He asked why. When you give injection, there Abhigata has happened, dosha vaishamya has happened, your krimi invasion will be there. That is why I can't. So that is why this dosha vaishamya, why Abhigata or ahara vihara is more important, most important for getting a infective disease. When you have very good Vyadikshamatva, Samadosha, you can't get any disease, even corona also you can't get if you have good dosha, samya, avastha. If dosha, vaishamya is there, definitely you can get all these diseases. So with this understanding, when you treat such cases, Shodhana or Shamana and Gugulus, Rasavashadis, everything is okay. But when there is a Tivra Avastha, what you have to do? The Chakradatta says, Dimbasta Savirasto Vatavittatmashta Kshinadha Vigarashta Bahudosho Ati Visrutaha. A Dimbasta, pregnant woman, old age person, Vatavitta Pradhana Vyadhi, Kshinadha, small babies, Jwarartasya, Jwara, Atisara, these things, Bahudosho Ati Visrutaha, severe status asthmaticus, severe status epilepticus. When such conditions patient comes to you, what we have to do? Then he says, Amopi Stambaniya, Pachanat Marana Bhayat. Even it is Ama stage. Actually, Ayurveda treatment is Ama Pachan Chikitsa. But Ama Stambhana is not told. When this severe state is there, you have to do Ama Stambhana Chikitsa. If you see the modern medicine drugs, modern pharmacology, most of drugs are receptor blockers or prostaglandin inhibitors. These are all Ama Stambhanas. That do Stambhana, that symptom is relieved for time being. Then again, when its action goes, again patient regains the symptoms. That is Namastambhana. But there is a role for this when there is a acute state, severe acute state. Otherwise, we should not do. Actually, in a normal case, we have to do Amapachan Chikitsa. But antibiotics or these are all Hetu Viruddha Chikitsa that can be adopted by Ayurveda. Now, so, if a patient presented with the Madham or Sannyasa along with Akshepaka or Kshagata, then cause of Raktadushti has to be elicited. If it is due to Raktaja Krimi, Krimi Chikitsa should be done. If it is by Abhigata, Shalya Chikitsa should be done. If it is by Doshaja Raktadushti, Doshaja Marma Abhigata, then dosha has to be treated. How treatment principle should be we have adopted our treatment? So Sushruta Charaka has said when kapha and pitta is involved along with the vata, first pitta should be treated, then vata. Kapha and vata, first kapha, then vata. When kapha, pitta, vata, all three doshas involved, first pitta should be treated, then kapha, then vata should be treated. I hope you understood. So since here pitta should be treated first, what is the pitta symptom in a pakshagata in acute state? They come with the murcha. Then we have to analyze what is murcha chikitsa. Sekagmana, Sahara, Shita, Pradeha, Vajanajalascha, all Shita, Parisheka, Shita Vaga, Shita Pradeha, Shita Lapani, etc. Then Pitta Jwarahara Chikitsa. And Kujana Savrodam, Kshiram Pibetya Anashina, Murcha Prasaktam, Tantu, Shiro Vireke, Jayeda Vikna, Manisha Tikshnehi, Tikshna Shiro Virechana, Tikshna Mana should be done. Now, Abhikshnam, it should be done repeatedly. Now, question arises. What do you mean by, question arises, can we do Tikshna Shiro Virechana? We have already told when it is in Murcha or Mada, it is a Pitta Meva Prabhu, Pitta Pradhana Avastha. How you are doing Tikshna Shiro Virechana? Is it not wrong? The same question arises to Dallan also. What he says, Yadyapi sarvamurchayam pittam pradhanam tikshne nasye vamane nayuktaha. It is not right. Then he says, Tathapi samjnamah sroto nirodha shanti karatvat vyadhi pratyanikatvacha ite eva. Samjna sroto nirodha is there due to tamo dosha or kapha dosha. To remove that as vyadhi pratyanikatva chikitsa, you are giving tikshna nasya. But usually, when you do the Nasya Karma, usually you give Abhyanga and Sweda. Since it is a Pitta Pradhana, you have already done Shita Parisheka, Shita Aleka, etc. After Shitala Chikitsa, if you give Tikshna Nasya, patient Sroto Rodha is removed, patient awakens. That is what he says. Prabuddha Samjam, it is Buddha Samjam, Amano Tikshne, Palatrika, etc. Then Jirna Grita, Harita Kekvata Grita, Datre Palasuswarasa Grita, these Gritas, Kashayas, Narikelambu with Samasharkara and Shatavari Bala Mula Draksha, Kshira Kashayas and Jwaragna Kashaya. If it is Vata Jamada, Vata Jwaragna Chikitsa, Pitta Jamada, Pitta Jwara Chikitsa, Kapha Jamada, Kapha Jwara Chikitsa should be given. Now, till now, and Mathulangarasa and Ashtavisha Sarpi, Kalyanaka Grita, Tikta Sarpi, Trifala, Chitraka, Shilajitu, these are many Rasayanas he has told for Madha Murti Sanyasa in the Vidishoni Adhyaya of Charaka. Now, with this understanding, these are the treatment we have analyzed for Murcha, not for Pakshagata. Now, what is Pakshagata Chikitsa? In Sushruta says, Tatra Prageva Sneha Sedopana Mruduna Shodhanena संशोध्य अनुवास्य आस्थाप्य च यथाकालं आक्षेपक विधानेन. You see, स्नेह स्वेद न मृदु शोधन, मृदु विरेचन. Then samshodhya anuasya astha, anuvatana asthamana should be done. It is for pakshagatam. Then at the end there is a word cha yathakalam akshepaka vidhanena. What do you mean by that? When the patient, a pakshagata patient comes in state of akshepaka, what should be your treatment? Your treatment should be for akshepaka, not for pakshagata. If you see acute stroke, when they come to your hospital, just after attack, just 2 hours or 6 hours or just 1 day, they come with the akshepaka. You have seen, if you have seen the cases acute state, they will have rigid muscles. Akshepaka, don't think there will be severe convulsions. Severe convulsion will be there in some patient with just rigid muscles and eyes are moving one side. This indicates there is an akshepaka. When patient is in akshepaka, what should be your treatment? Should be for pakshagata or akshepaka? Your treatment should be for akshepaka. Then what is akshepaka chikitsa? That is what Sushruta says. When a pakshagata patient comes in state of akshepaka, that is acute state. The acute state of stroke means it is always in akshepaka avastha. If akshepaka is there, don't think there may pakshagata avastha. If pakshagata avastha, you go for pakshagata chikitsa. No need of all these things. But when it is in akshepaka avastha, your treatment should be for akshepaka. What is akshepaka chikitsa? Tatra prageva sneha abhyaktam sinnam opadya tikshneena upakrameta shirashuddhyartham. Abhyanga svedana tikshna shiro virechana avapedanasya should be given. After that, Anantaram, Vidari Gandhadipatham, Mamsa Rasakshiradipakham, Sarpir Achanchapayet, Acha Sarpi Pana should be given. By that, Nati Matram Vayu Prasarayati. Vayu Prasarana to the Shaka can be prevented. So, here the question is Acha Sarpi Pana means what? Acha Sarpi Pana, without mixing anything, you have to give Acha Sarpi Pana. How much should be given? This question, how much Sarpi should give? So, if you see in Panchakarma Adhyaya, in the Snehana Adhyaya, ye Murcha Rogi or Sarpa Vishadamshtra Murcha or Unmada Rogi, in these patients, he says Sarpi should be given in Prabhuta Matra. That means Sarpi is digested in 24 hours. Usually we give our practice about 250 to 300 ml, about 8 palas of Grita is given to the patient immediately after Nasya. Once it is given, patient takes inside and there is no vomiting. Such patients will survive. There is no chances of akshepaka afterwards, severe akshepaka. All the akshepaka is subsided, patient is stabilized. So after that, he says Parisheka, Abhyanga, Parisheka, Swedas, Abhuktapitam Radhimarichayachayuktam Avatanakam Hanti. And then Sneha Virechana, Astapana, Anuvasana. Like that, you have to treat Dasharatra Huta Vega Upakrameta. 10 nights you have to treat. By that, Akshapaka Vega will go. Then Vatava Chikisa, then Pakshaka Chikisa, you should start. A Pakshagata patient comes in state of Akshepaka. You have to treat by these means for 10 nights. By that, his rigidity of muscle will go. Akshepaka will go. Then you have to go for Pakshagata Chikisa. Now here, this last sentence is very important. Etat Shuddhavata Patanakam Vidhanam. It is for Kevala Vatajam. Usually, if you see in cases of acute stroke, they will have Pitta and Kapha symptoms. Samsrishte. When Pitta Kapha Samsarga is what you have to do? Samsrishte, Samsrishtam Kartavyam. What do you mean by that? Then Dallan says Pitta Kaphayo Samsargam Pitta Kapharam Samsrishtam Tadev Kartavyam. Then Jejata says Jejatastu Samsushte Vatarakta Chikisam Kartavyamiti. Vatarakta Chikisa should be given. Now this becomes very interesting. You see, we have analyzed Madha Murcha Chikitsa, we have analyzed Pakshagata, we have analyzed Akshepaka Chikitsa. Now here comes, he says you should go for Vatarakta Chikitsa. If you see the book, there will be Vata Javatakta Chikitsa is different, Pitta Javatakta Chikitsa is different, Kapha Javatakta Chikitsa is different, Sannipata Javatakta Chikitsa is different. Now, which Vatarakta Chikitsa we have to adopt? Then Samsushte Vatarakta Chikitsa means, since we are treating a Pittaja state, we have to analyze Pittaja Vatarakta Chikitsa. What is Pittaja Vatarakta Chikitsa? You see, Pitta Prabale, Drakshadi Kashaya, Shakkara Madhumaduram, Guduji Kashaya, Pitta Jwara Hara Kashaya, Chandanadi Kashaya, Madhutikta Kashaya Sarpi, Shatadavdagrata Alepa, Shitala Parisheka, Shita Alepa, whatever told for Murcha, Murcha also Pitta Maya Prabhu, same told for Pitta Jvatrakta. Same drugs. Like that you have to treat. So with this analysis, treatment of Pittaja Vatarakta Chikitsa, that is Shita Parishita Alepa, Shita Madhura Kashaya, Pitta Jwara Chikitsa, Madhura Tikta Gruta should be used, Shatadavta Gruta Alepa. The same line of treatment also told for or Madhamurchanyas also. So here we have adopted the same treatment is told for Pitta Samsargaja Akshepaka with the Pakshagata. In addition to this, Chikshanasya is told according to Sthan of the disease. Now, when this confusion is there, multiple symptoms, multiple signs and symptoms in a case, because acute stroke means they will have Pakshagata, they will have Akshepaka, they will have Madha, Murcha, they will have Gaurava, Stainitya, all these symptoms are there. You are totally confused. Then Rasavisheshika Sutra says, Idam eva pradhanam, idam na iti avadharanam na yuktam, chikitsayam avastha vidhanam hi pradhanam. According to avastha of the patient, you have to treat. Then I think all confusion is solved here by this shloka. Which avastha is there? You see that avastha. Then Charaka says, Cha avastha dosha kala balam prati. These all things we have to do. Tasma kuryat satya videshe kuryat guhya swayam dhiya. With your own intelligence, you do uhana of the condition. Which avastha is there, which dosha is involved. Do karyakarana vivechana, tarkya. You have to do the chikitsa. Vina tarkena, ya siddhi. Without these tarkas, you give some treatment, sometimes patient gets result. But that occurs due to yadricha, not your treatment. With the tarka, with the analysis, if you give a specific treatment, you get the result. You can demonstrate the result. So satyam ah. First you do dosha nirupana, then aushad nirupana should be done. I think now you understood hetu sthana vishesha, bhaved roga vishesha. Hetu vishesha is pittavarnadi. In this condition, hetu vishesha is raktavarna. Sthana vishesha tiryagadamani is urdhva dehaka. So in this condition, the hetu vishesha is raktavarna. that for Rakta, there should be Rakta Dushti. It may occur either Pitta, Kapha, or Vata, like that, Pitta Samanmaya, Kapha Samanmaya, or Kevala Vataja, or Rakta Surdajanya, anything can happen. That is Hetu Vishesha, then diagnose it, give specific treatment. So, to conclude with this Aptopadesha, so a semi-conscious state is Madha, unconscious is Murcha, coma is Sannyasa, conversion is Akshepaka, hemiplegia is Pakshagata, or Pakshagata with the Pitta, Kapha, Samsargaja, with the Daha and Murcha, all these indicate Raktadushti pathology. Is Raktadushti by dosha or krimi, abhigat, is dosha inishya. Then treatment should be done. Now, this all analysis okay. Now, patient comes to you in the hospital, in a clinic. Now, what we have to do? We have to diagnose. First, we have to do diagnose sthana vishesh vyati. What happens? Patient will come with one-sided weakness. That is a pakshagata. One-sided weakness is there. You diagnose the pakshagata. So that indicates the pathology is Tiryagadamani Uddudega. Sthana Vishesha you have find out. Or patient come with the Akshepaka, Pakshagata with the Akshepaka, conversion, or rigid muscles. You have diagnosed the Sthana Samshesha. Then you can substantiate it with the modern investigations like CT scanning or MRI scan. By this, you will understand which place of the brain, how much is involved. Is it due to infarction? Is it due to hemorrhage? Is it due to infection? Is it by growth? Is it by injury? All these things you will understand. Is it by abhigata? Injury or growth will be there. Is it by krimi? Infection will be there. Is it by dosha vishesha? Rakta dushti? By kapha or pitta? Usually there will be infarction or intracerebral hemorrhage. So hetu vishesha, which dosha, that we have to analyze, not by this seeing infarct hemorrhage, by seeing signs and symptoms. If Madha Murch Sannyasa is there, it is a Pitta Samanmaya. If heaviness, numbness is there, that is a Kapha Samanmaya. If it is Ruja and Stamba is there, that is a variation movement, that is Vata Dosha. If there is a Sparshadvesha or Ekadesha, that indicates Raktavarna. Here, Sparshadvesha cannot elicit because Mandalani Shvayato occurs inside the brain, inside the bone. That is why you can't elicit. But you can see in the CT scanning or MRI scanning this Mandalani Shvayatu, Ekadesha. That is Raktavarna Vataprakopa. If a patient comes in the later stage, after 6 months, there will be, that is in Natukshaya stage, there will be wasting of the muscles. In acute state, there is no only loss of the movement and pain will be there. Or speech loss will be there if it is in the right side. This you can find out, these all symptomatologies, you can understand what happened to the patient. Then analyzing the treatment, Shita Parisheka and Shita Alepa. According to dosha, then Ausha Nirupana. You see, Shita Alepa, since it is a Pitta Harachikisa, patient is in Madha Murcha symptoms, Pitta Harachikisa. Then Tikshna Nasya is removed to remove this Roto Rotha, Tikshna Nasya. When patient is awakened, then you start Acha Sarpipan to prevent Akshepaka. The increased Akshepaka is prevented. Then Shunti Surasa, Jara Harachikisa, Jara Amapachana treatment should be given. Narikela Jala, Trifala, Shilajita, Rasayanas, Kamaduda, Rasa, etc. All Shitara Chikisa should be started. And Lakshman Rasa or Mrityunjaya Rasa, these things should be treated. If it is due to krimi, don't do these things. Go for Krim Ratha Yuga Chikisa. Either you do or you refer the case for a Krim Ratha Yuga. If it is by Abhigata, send for Shalya Chikitsa. This is Aushadhi Vinishya. Now, how it can be done in a ICU setup? Let us, I am showing some videos. Okay, madam? Hello? Am I audible? Hello?
Yes, sir, you're audible.
Yes, I will show some videos now. Okay?
Okay, sir.
Okay. Just you see how it can be done in the ICU setup. I am showing some videos. So I think till now I explained all concepts. Now practically we are seeing how it can be done in a ICU setup. You see, here is a patient aged 70 years. He is blind from birth. He had right hemiplegia due to lacunar infarction. As soon as he came to me, I sent him for a CT scanning. It was diagnosed as lacunar infarction, right-sided hemiplegia. He is in semi-conscious state. He is not completely conscious, semi-conscious state. Now, what we do is, one person start to apply Shatadhavata Grita Alepa. It is told, in the shloka it is there. We are applying Shatadhavata Grita all over the body, even leaving 1 inch. It's very important. Just you see, we are applying Shatadhavata Grita. Okay, can't. ಹೇಳಿದ್ರು ಟೈಮ್ ಲಿಮಿಟ್ ಇದೆ 40 minutes. So just we are applying the Shatadhavata Grita all our body. And another person is doing Dhara Chikitsa. This is Dhanyaka Namalaki Hima. Dhara done. Simply you can do in OPD, in ICU. With the giving oxygen also, with the seeing blood pressure or monitors, you can do this procedure very easily. Usually we do this Shitala Dhara for about 20-25 minutes. Apply this Shatadhavata Grita. Okay. After about 20 minutes, 20-25 minutes, stop it. Then we apply Manjishta with Manjishta. You see, this person is very ಗೊತ್ತಾಯ್ತು. To 1.5 ml Shays had put on his both nostrils. Now he is awakened. It's a right, left leg. Even the right hand he could not raise. Now he started to raise his right leg. See, just you see now in a minute what happens. So, he able to spit out, he awakened from semi-conscious state, Madra state. Yeah, it is very Tikshanasya. I will tell what is its combination. Now you see, after Nasya, he is able to raise his right leg immediately. See, this is what happens. Now, why and how it happens? If you see the blood pressure after doing Nasya, usually patient comes with the 200 by 120, 250 by 150 like that. Blood pressure will be there. After doing this Shita, Chikitsa, and Dhara, Alepa, and Nasya, Usually BP comes down to 160 to 100, is stabilized, becomes stabilized. So like that we do this dara about 5 times a day. Now why it happens? Why it happens to that we should understand why blood pressure raises first of all. Even a normotensive person, if he gets a stroke, then BP gushes up. Why it happens? Because Ayurveda will say Srotoroda goes, that is why he his BP comes down, he raises, it's like everything you can tell. But according to Western science, can we tell? For that, we should understand why blood pressure increases first of all. If a normotensive person, if he gets a stroke due to infarction hemorrhage, immediately there will be rise of the blood pressure. Why it happens? Because of this area complete dead tissue will be there. Around this there will be big area of inflammation. Due to this inflammatory swelling, there is a big area of congestion. Congestion is decreased blood supply. When decreased blood supply is there, the brain cells in that area, they start to weep. उसको food नहीं है. So it will weep. Food दे दो. उसका food कम देगा. Who is its mummy? All mummy of these brain cells is hypothalamus. That stimulates hypothalamus. When it is stimulated, hypothalamus thinks that there is no blood supply to this brain cells. Oh, so that is why food supply is not there. Oxygen is not there. Food is there. Immediately hypothalamus stimulates adrenal glands. Adrenaline is produced more, noradrenaline is produced more, there will be peripheral resistance increases, heart beats more, so that blood pressure gushes up. When blood pressure gushes up, so this in this area there is already block is there, that is why blood cannot go. So this vicious cycle continuously happen. That is why after a stroke there will be continuous elevated blood pressure. In such conditions, if you give antihypertensive to decrease blood pressure forcibly, slight blood supply is there, this area, still blood supply stops. A patient comes to you vertically to your hospital, he becomes horizontal. So instead of that, what Sushruta's principle, just you see how he has treated. He did not reduce blood pressure forcibly. Just you see, Sushruta principles of this Tridosha Siddhanta treatment, Karyakarana, Vivechana, according to Tridosha Siddhanta treatment, just you analyze it. And according to Western science, if you analyze, what he did is, this Madha Murcha Avastha or Akshepaka Avastha with the Madha Murcha Sannyasa, he thinks that it's a Pitta Pradhana Avastha. You have to do Shitala Chikitsa. When you do Shitala Chikitsa for head and all our body cools down, muscular activity, body activity cools down. When activity cools down, corresponding nerve activity also cools down. When corresponding nerve activity reduces, corresponding nerve activity in brain also reduces. When it is reduced, need of oxygen reduces. When need of oxygen reduces, stimulation to hypothalamus reduces. At the same time, stimulation to adrenal reduces, adrenal production reduces. Slowly, as you go on doing Dara, BP settles down. Then, without disturbing the body system, you are putting Tikshna Nasya, immediately blood gushes into the brain. Wherever that area is there, that will start to movement. That is why slowly, that is why we are doing repeated Nasya, repeated Dhara, etc. Like that, still it is stabilized. So, here question comes, what are the drugs? The drugs are used as simple, Yasti, Pippali, Vacha, Maricha, Hingu, Saindava, Lavana, and Kshira. This drug we are using according to dosha again. When it is Madha Avastha, patient is in Madha Avastha. If it is Kaphaja Madha, Tikshnata of Nasya is increased by using Yasti, Pippali, Vacha, Maricha, Hingu, Saindava, Lavana. If it is Pitta Jamada, then Tikshness is reduced by using ST Vipali or ST Kshira only. It is Vataja. We use Yashtivachamaricha Hingusaindavalana with the Kshira. This is how we analyze according to dosha. We change. If patient comes in Murchavastha, then either you can use Yashtivachamaricha Hingusaindava without Kshira, or you can use Shwasagutara, or you can use still Sannyasa Avastha, you can use Lashunaswarasa. A Tikshna, very Tikshna can be used. So according to dosha, you analyze and select the drug. Then how much time? Repeatedly it should be done. Now abhikshna means repeatedly. What do you mean by that? You will tell repeatedly. That's a translation of abhikshna, that's all. But practically what is its understanding? Should you do once in 10 minutes, once in half an hour? How? So what Sushruta says, per day, once in Yamamatra you can put the nasya, per day about 3 nasyas. Even if a patient comes in midnight, the rainy season, we don't say when it is an emergency, we don't say in the rainy you should not do, in night you should not nasya. Like that you are not doing. Any Tikshnata is there, you should do then and there itself by saying that is Avastha Vasham Chikisam Purya. We do Shitala Dhara and Tikshnanasya immediately. Then once in the 3 hours or 4 hours, repeatedly per day, about 3 times Nasya and 5 times Dhara is done. So that the patient gets awakened, then he is able to drink the Grita. Now here comes the limitation. If after Nasya, if patient is not able to drink the Nasya, Grita, what you have to do? Then we have to put the attitude. Once you put the patient not able to drink the Grita, if you have to put the ice tube, that means that is a limitation of Ayurveda. We have to utilize, you have to either you have to refer the case to a modern facility or you have to utilize some modern medicines. So if complication arises, some aspiration may happen, patient may get breathlessness. In this condition occurs, then you have to take the help of modern intervention. If he is able to drink, that means you can manage with the Ayurveda only. So that is the limitation. Usually what we have seen is when there is a midline shift, a big area of the infarction or hemorrhage, usually the patient is not able to drink. In such conditions, it is better to refer the case to the modern facility. If he is able to drink, then definitely you can go for this one. After Shatadauta Grita, Snehana, after about 6 hours, you start to give Shunti Sorasa, Narikelambu, etc. Tarpana Chikitsa. This patient's video image of the CT scanning, just you see there is a lacunar infarction that patient. So now, like this, we do this Nasya, Dhara Nasya, about 4 days till this Akshepa goes. Akshepa means a rigid muscle state goes. Patient's muscle becomes flaccid or it becomes normal. Then for next stage, when the Pitta symptoms are gone, then we give Sneha Virechana, Snigdha Virechana by Eranda Taila. Eranda Taila, if Kapha Samanvaya, we give Eranda Taila with the Gomutra. If it is Pitta Samanvaya, we give Eranda Taila with the Godukta. If Kapha Pitta both is there, we give Eranda Taila with the both Gomutra and Godukta. When Virechana occurs, Pitta or Shamana occurs, then for Kapha symptoms come up. When Pitta symptom goes, Kapha symptom, patient start to tell there is heaviness, numbness, everything he is able to tell then. Then you have to go for Kaphara Chikitsa by Katutaila Abhyanga, Ruksha Alepa. Now you see Ruksha Alepa is done, Agnya Alepa, all our body is done. And for Abhyanga we use Sarshapa Taila and Basti Chikitsa we give accordingly. For about 10 days, Snigdha Mruduna Shodhanena Samshodhya Anuvasya Asthapya, like we do. This Alepa is done. Alepa is, I think, the students of Udupi, Hasan, they will do. Other students from other place may not be knowing. This has 5 wet drugs, 5 dry drugs, like Maricha, Lashuna, Sarshapa, Haridra, Lavanga, etc. And Nirgundi, Sairayaka, Shigru, these Patras wet drugs, Vanatulasi, these drugs are there. Badara is there. This patra you make it a chutney and apply all over the body without leaving it. This is for next stage, kapha stage, not in pitta stage. That is for a kapha stage. Avastha Pashan Chikisa when rigidity has gone, then we start this one treatment. Okay. This is a kapha state. You are applying this one daily once you apply. Next day again when you do abhyanga it goes again you apply this thing. At that time patient should have Shuddha Pathya. Only Yavagu and rice kanji should take. Okay. Like that, it has to be applied all over body. Okay. That patient who could not raise his leg just after 15 days. Just you see, he's walking on his legs. He is vertical, not horizontal. Okay. The same patient. Since he is a blind man, I have to hand him. See, he's able to walk. 70 years man. So this is another case of a brain hemorrhage. Came on 4th July. You see here, 4th July 2004 with the big hemorrhage. We have treated like this. Pitta symptoms were there. Pitta hara chikitsa. You see, intracerebral hemorrhage. Now just after 20 days, you see, on 31st July, all his hemorrhage is resolved completely. Okay. Same patient, that he video. Okay. This is another patient came with intracerebral hemorrhage with the intraventricular extension. With the intraventricular extension. See, on 27th January he came and we treated. See, by 19th February, what happened, you see, completely resolved. That patient is on vertically, not horizontal. Age is now able to walk with her for some time. About like this, after that we have to do Abhyanga Sweda, etc. for Vatahara Chikitsa. Pitta stage goes to Vata stage comes, then Abhyanga Sweda, this treatment, Tailathar, etc. should be done for about 3 to 4 months to gain complete recovery. So you see, she is walking on her leg. Now here another very interesting case. I want till now functional improvement you have seen. Is there anatomical improvement also there? That is why here one very interesting case. A patient of 65 years age came with the aneurysm. You see, there is an aneurysm. Aneurysm is there. Okay, in this MR angiography, this report is the MR angiography. There is a aneurysm with the bleeding. This patient was advised for surgery. He came in the semi-conscious state. When they came to my hospital, I also advised them to surgery because it's a subarachnoid hemorrhage. If you do clipping, usually patient gets relief. But the patient denied the surgery, refused surgery and came to me. They told her sister also problem. They underwent surgery. They lost life of her elder sister. That's why they came for Ayurveda treatment. You do whatever treatment, we accept the result. Then we started all the treatment. See, after treatment, just you see, there is no aneurysm is gone. Complete. It's anatomical defect also corrected. See, this is now normal and happy. Now you see, patient went outside the hospital vertically. See, so accordingly, in the stage of murcha chikitsa, it is pitta samsara akshepa chikitsa, shita parishita lepa, sarpepa, shitala paniya, jvara chikitsa, after pitta shamana, kapara chikitsa, still reachability of Matahara, Brahma chikitsa, part 3 to 4 months. To conclude, dose vikalpa after presentation of Vyadhis in different patients accordingly in different stage is most important. After dosha vikalpa, according chikitsa has to be done to get the maximum benefit. In present era, to succeed in Ayurveda, our treatment should be better than best in modern system of medicine. We can give better result with the Ayurveda with utilizing modern advanced diagnostic and management equipments and drugs. Some modern drugs may be needed if there is a complication. If patient develop complications of aspiration, pneumonia, or develops a severe convulsion, or patient not able to drink it properly, you may take help of the modern medicine drugs. Otherwise, no need. Otherwise, we can manage with our Ayurveda treatment. Say before and after, many this one is there. So with this, I conclude my presentation. Satatadhyanam Vadaha Pratantralokanam Tadvidyachara Sevacha Buddhimedha Kuro Ganaha. Here, Satat Adhyana you have to do, discussion you have to do, and most important is Seva. Work along with the Acharya. Who is doing, if you want to learn any science, you work with him and understand the principles, understand the different stage of the Vyadhi, understand the complications, understand how to treat such a condition. Then you can start. So someone you should ask me by seeing these videos, can we start Nasya from tomorrow onwards to their opinion? So I think this is very difficult to answer. You see, unless you understand the proper principle of the disease and its treatment and its complications and the treatment of complications, I don't advise anybody to go directly start the treatment. Understand it, work with the acharya, get first-hand experience, then you start your treatment in your clinic. So, with these words, I am very thankful for giving this opportunity to share my experience of acute stroke. Thank you very much, sir. Thank you very much. Okay, madam. Any questions?
Thank you very much, sir. Thank you for a wonderful session on Pakshagata's management. We got to know Avastha Chikitsa, Avastha Anusara Chikitsa. Thank you very much, sir, for the wonderful session. It was very helpful. Now we'll continue with the some discussion session. Few of them have asked questions, sir.
Okay, definitely.
Yes, sir. The first question is, Prabhuta Matra Sneha is whether Shamananga or Shodhananga?
Actually, it is an emergency anga. Okay, it is an emergency anga. I can say that is I can tell Atyeka anga. In that state only he said it is not Shodhananga or Shamananga. In that acute state, just after Tikshnasya, you should give Prabhuta Mata Snehapana. Once you give this Snehapana, Vata Prasarana to the Shaka is prevented. In Sarpa Visha comes to also, he says, just after do, immediately you give Prabhuta Matra in Visha Chikitsa also. So this is actually not Shamana or Shodhana. Yeah, I think you can tell Atyeka Anga Chikitsa. You can coin that word, that is better. Okay. Then we are doing again Nasya. After 3 hours again we do the Shitala Dhara and Nasya. So we are not stopping your Nasya just after Snehapana. Otherwise, after Snehapana you start 3-day Virama for Virechana or as a Shamana. Again, Shamana means again next day you have to give Vrita. Like that you are doing only once.